Welcome to our video, The Symbiotic Relationship Between the Aesthetic Physicians and Dermal Aestheticians. In this video, we share how the somatologist adds value to medical professionals practicing aesthetic dermatology and also the other way around. I'm Riet van Tonder, the Sales Manager at Isa Carstens Academy. And let me introduce you to our speakers. So first, Dr. Sarita Kannenberg. Hi, Doctor.
Hi there.
Hi, thank you for joining us. Dr. Kannenberg is a consultant dermatologist at the University of Stellenbosch and Tygerberg Academic Hospital, since qualifying cum laude as a specialist in 2012 at the same university. She teaches pre-graduate and postgraduate students in the field of dermatology, is involved in research and writing for scientific journals. She features regularly in the media, creating public awareness on various dermatologic topics. She plays a formative role in dermatology in South Africa by serving on the executive committees of the Dermatology Society of South Africa and the African Women's Dermatologic Society. She also has a private practice in the northern suburbs of Cape Town. Dr. Kannenberg focuses on medical dermatology, in particularly acne, pigmentary problems, pediatric and aesthetic dermatology. She practices a multimodal approach to treat the whole patient, not just the skin problem. She strives to enhance her patient's natural beauty as economically as possible with the most up-to-date treatments and always keeps safety in mind. She also lectures at the Isa Carstens Academy to our students in Advanced Dermal Aesthetics. And then next, who joins us is one of our lecturers, Annika Pinaar. Hi, Annika.
Hi, everyone.
Hi, thanks for joining. She is our lecturer at the Stellenbosch campus. She holds an advanced diploma in dermal aesthetics. She has 2 years work experience in working in the medical aesthetic environment. And like I said, she's a lecturer. And then also, lastly, Mandy Thomas. Hi, Mandy.
Good morning.
Morning. So Mandy is also an advanced dermal aesthetics coordinator at the Stellenbosch campus. She has a Master of Technology degree in somatology, and she has 9 years in industry experience, 7 of which was working alongside medical practitioners. 4 years served as part of higher education and currently running various aspects of the Advanced Diploma in Dermal Aesthetics program, as well as responsible for research methodology subject, which forms part of the Somatology Diploma course and the Advanced Diploma course. So my first question is going to be to our lecturers, starting with Mandy, and I want to specifically talk about the value or the added benefits that this symbiotic relationship gives to the patient or the client. So based on your experience, Mandy, what are those extra benefits?
So firstly, a dermal aesthetician has a more clinical and specialized focus. So all the treatments in aesthetics has been well researched. So the patient can be reassured that the modality and the treatment being performed is based on recent scientific evidence. Therefore, the patient will receive realistic and achievable results. Now, before we even perform any treatment, a pre-operative consultation is another benefit that the client will experience. And in this consultation, there will be a discussion on what to expect during the treatment. So this will give the patient a psychological ease, as well as allow the patient to mentally prepare themselves for the procedure. Now, in the Advanced Diploma in Dermal Aesthetics, there is a focal study on wound healing and the wound healing cascade, which plays an enormous role in preparing the patient to what's expected after the treatment. Because many of the aesthetic treatments involved a control injury. So we injure the client in a controlled fashion. So having this great knowledge and understanding, the dermal aesthetician can predict and can control the outcome as well as lower any associated risks of the treatment. And then finally, I think another benefit for the patient is that they can feel confident that the dermal aesthetician has comprehensive training, and I'm speaking specifically on formal training in dermal procedures that is obtained by an institution that is registered with the Department of Higher Education. Now, most of these aesthetic treatments being performed in the aesthetic industry is not really covered in the health and skincare diplomas, or not really covered much in the dermatology diplomas because it's not part of their curriculum. So the patient can be at ease. The person that is performing the treatment is actually qualified to do so.
So Annika, what would you say are some of the added benefits for the patients?
So some of the added benefits to the patients, I would say, in a services perspective, is that when they visit a medical practice where the doctor works together with the dermal esthetician, is that even though the patient is receiving a medical grade treatment, the overall patient experience will be of a good quality, as they still receive that gentle therapist touch from the esthetician. And then the patient can also be assured that the sufficient amount of time will be spent on the practical procedure, as the consultation part of the treatment and the actual hands-on treatment are divided between the doctor and the therapist. And then this also allows a holistic approach, as the medical procedure will be the doctor's responsibility, whereas the non-medical procedure to enhance or maintain the results will be the responsibility of the dermal esthetician. Something that I think is also of high value to the patient, and what I see as very important, is that the dermal esthetician has extensive knowledge on cosmeceuticals and topical intervention. Therefore, home care and post-treatment recommendation can be made, and it can be altered to meet the patient's specific needs, which at the end of the day plays such a vital role as to the results. Yeah, I think that is the most important to me.
Thank you, Mandy, for sharing, and for Annika. My next question is for Dr. Kannenberg. If you could perhaps give us your expert knowledge on, or experience on, what are the value specifically for you as a medical practitioner due to the symbiotic relationship?
Thank you. Yes, because of the different skill sets that the various professionals bring to the table, we obviously have a much better result. The physician focuses mostly on pathology, whereas the therapist or somatologist rather would focus on the physiology. And I can use an example of one of my somatologists told me about deep and superficial dehydration, which I wasn't aware of, and really contributed to my consultation. This, of course, leads to a much happier client, a much more satisfied client, which leads to greater client retention and more profitability for the practice. The somatologist would also be able, and because of the cosmeceutical knowledge that we've already discussed, they would be the much better person to discuss the home care, which would enhance the results of the treatments and obviously also lead to profitability in the practice. They also help a lot with time management, as they focus on the medical, so the medical practitioner can focus mostly on the medical procedure itself, as the somatologist would help with the pre-care information, post-procedure, post-care information, and therefore also contributing to the whole running of the practice. They also contribute to practice management and administration, which also frees up the doctor's hands. They assist the doctor also with medical treatments in most cases, And they also help to prepare the workstation of the doctor. And everything, all of this leads to a much smoother flow in a practice, much better profitability as well in the end.
Thank you so much, Doctor, for sharing that. So we've looked at the value for, the patient, for the doctor, and now, Annika, if you could perhaps also share some of the values or the added benefits to you as a dermal esthetician. I know you have also experience working with medical practitioners. So how does it help you?
So for the medical, the esthetician, there is, I think there's endless benefits, and I would like to share a few that I have experienced. So, yeah, as I say, talking out of experience, one of the most valuable benefits I have gained from working with a dermatologist is continuous learning through observation. I found it very valuable to be able to ask questions and get an answer from a medical point of view. I think this is one of the absolute best ways to up your knowledge and your skills as a dermal esthetician. Also, talking out of experience, when working with a medical practitioner, such as a dermatologist in my case, it allows you to see more than just what is in your scope of practice. Again, this is the environment where you learn so much. And then lastly, by working closely with a dermatologist or a medical practitioner, it opens so much more doors for you as a dermal esthetician. Work opportunities grow when you get this type of experience. For example, you can become a medical sales representative or for a medical product brand, or you can become an educator at a training institution. And I think also one of the more important benefits for you as a dermal esthetician is that when you are in this environment, it gives you that added benefit of a higher income as well.
Thanks, Annika. And I know, Mandy, you also have experience to share here.
Well, I think one of the great benefits of, when completing the advanced diploma in dermal aesthetics is that it allows the opportunity for further studies. So, such as your postgraduate degrees, your master's degrees, your doctoral degrees. So, should you want to go in the more academic route, you can do so, and there's opportunity for you to do so. Now, the main focus in these types of the degrees is conducting research. And within the advanced diploma in dermal aesthetics, so there is a subject called research methodology. So should you have a passion or spark a desire in the research aspect, you can then take that passion and study it further and then move or have the opportunity of academic growth.
Thanks, Mandy. So I also want to ask both of you again, what advice can you give to prospective students wanting to direct their careers into the area of skincare specialization to specifically work in collaboration with aesthetic physicians? So maybe Annika, you can start.
So I have had the questions many a times from students specifically, should they do the advanced diploma in dermal aesthetics? What is the benefit of it as we are speaking about it? And I always say, so my advice to them is, yes, do your advanced dermal aesthetics diploma, as Mandy said, and as I said myself, it opens so much more doors to further studies, to income, which I mean is important. And yeah, if you can work with it, if it is your passion to work in the aesthetic field, then definitely go for it and push through, do that extra year. It is absolutely worth it. Yeah, again, out of experience, I won't say I'll do it again, but I'm happy that I did it.
Mandy, what advice can you give to our prospective students?
So students that want to join or enroll in the advanced diploma course, or the discussions that I continuously have with students, is to make them understand that the treatments that is taught within the advanced diploma have its associated risks. Now, risks I'm referring to as the risk of scarring, the risk of burns, the risk of pigmentary changes. So therefore, training becomes an essential part to avoid malpractice as well as to avoid adverse side effects. Now, there's many studies that have shown that injury resulting from these aesthetic treatments is due to insufficient training and inadequate training. So it is important, if you're not formally qualified and trained to perform these aesthetic treatments, then you should stick to the scope of practice within your training. And if you want to do these aesthetic treatments, that you need to qualify yourself to do so. And this ensures a safe as well as an ethical practice, which is important.
Thanks, Mandy. And then I want to ask Dr. Kannenberg, perhaps what advice can you give to other medical practitioners with regards to what they need to look out for when hiring supportive aesthetic staff to work in their practices?
Thank you. Yes. I think that qualifications is the most important feature that we want to look at in as stomatologists. They need to be qualified at a reputable facility that is registered and accredited. Personality traits also very important, I find, as we generally work very closely together. So we want to make sure that we have a team player and that they also know their limitations so that they don't function outside their range of practice. They need to be a member of the Industry of Professional Bodies of South Africa, and in South Africa that is called SAQA, which is a professional body for skin, body and nail care industry. It's a legally constituted organization and is to protect the public interest in relation to services provided. The stomatologist that you employ needs to be a professional, as has been my experience with all the Isa Carstens alumni that I've worked with before. Thank you.
Thank you so much, Dr. Kannenberg and Mandy and Anneke, for your expert opinion and advice and information shared today. So this is the end of our video. Stay safe, happy and calm, and goodbye, everyone.